Doctor, before we look at the symptoms for any mother or father to look out, we've had issues where mothers take so long to conceive after using family planning. What's the theory behind that?
Yeah, so family planning, if it's used correctly, it shouldn't cause a problem, because there are some family planning methods which are temporary, others are permanent. And before somebody gets onto any particular method of family planning, they should have that information and make a choice. Yes, they should be knowing that this one, the one I'm taking on, is not going to be reversed, or is going to be reversed. And if it's going to be reversed, it is going to be reversed immediately, or it may take some time. So basically, if we have the right information, we should not be accusing family planning.
To be helping us to make.
We should not be accusing family planning methods for infertility.
Thank you so much, Doctor. There is a parent, a lady was asking me yesterday that does family planning comply with blood group? That please ask doctor, because sometimes we go for these things and we don't know that this one works with my blood group or not. So I was like, fine. And she's watching. She wants to hear that.
Yes. So that's actually that's a very common question people ask. It's a very common question people ask. And the answer straight before I go into the details is there's no relationship between blood group and the type of family planning you can use. When you're choosing a method of family planning, there are different factors we do consider. One of them maybe is how many children you want to have, for how long you have to have this family planning method, whether you have other diseases like heart diseases, blood pressure, or diabetes. Those are considered, yes, but it is usually not related to the blood group.
And yet sometimes we keep quiet about our medical status. We don't say it when we're taking this family planning.
Yes, so that is that is very true. So for blood group, no.
There's nothing.
There's nothing related to the blood group. We know. I hope we know what we mean about blood group. Blood group. Our blood falls in groups. We give them names.
Yes.
Blood group A, blood group B. We have blood group AB, and then we have blood group O. And each one of those may either be rhesus positive or rhesus negative. So your blood group comes out as A plus. That means it is blood group A, rhesus positive. Or it comes out as B positive or B negative. So that's how blood group comes. But it has nothing to do with the method of family planning that can be appropriate.
Thank you so much. Let's look at the symptoms that, especially a woman, let's start with a mother, that a woman can look up to and know infertility is closing my door. Yes.
So basically, infertility by itself, in most cases, they do not have like any other symptom. What actually can be a symptom is the underlying cause of the infertility. But infertility is defined by the time period. We only define it based on how long these people have been trying to conceive. Yes. And so that's it. So we cannot say this is a short person, is going to have infertility, is a tall person, or is having headache. No, it doesn't work. But otherwise, some of the causes of infertility do have symptoms. For example, endometriosis can affect the tube, and it can present with painful periods. So if somebody is having a delay in conceiving and also has painful periods, you may think that they have endometriosis, which is causing the infertility. But infertility is defined only by the time period in which the person is not able to conceive.
Thank you so much, Doctor. I think you've got the answers right from Doctor. Infertility or family planning does not match with our blood group as a mother. You just need to be open and tell the medics who is going to administer your family planning. You tell them whether you have any underlying medical condition like pressure, this and that, so that they can advise you accordingly. Otherwise, I think it is safer. Thanks so much for joining us. Once again, this is still Medical Minds, and we're looking at basics of fertility treatment options. Doctor, who is eligible to fertility treatment? At what age can you really say this person needs treatment?
Yes. So Now with the recent articles going on, I can see that top question is a bit political, but it is fine. Well, anybody desiring to get a baby is eligible to fertility treatment. Now, the option of the fertility treatment will depend on a number of factors, but anybody who is desirable of having a child
and that failed, that tried and failed.
Have tried and they're not conceiving is entitled to get fertility treatment.
After taking all the options, after checking up, seeing the sperm counts, things are not working out, you can now say, much as you are young, you're only 25 years old, you deserve this. That is very good. Thank you so much, doctor. Yes. At what stage does one need to start treatment, really?
So usually if the couple has been trying to conceive for 1 year and the pregnancy is not coming, they should go and first have assessment. Now, based on the assessment, the health workers the fertility experts should be able to say yes. There are some cases where you can say no, you can hold on for some more months.
Okay, you still show some positive...
Yes, you can still conceive on your own. Maybe there were some few things that needed to be fixed. For example, timing, maybe you're not... some people don't stay together, they are having meetings only on the weekends.
Once in a month,
somebody is staying in Juba, another one is in Uganda, and like that. So you may not be able to time very well. But let the health worker see if this will be suitable for you. But then he can also go ahead and say, okay, maybe you need some other forms of treatment. So we have a myriad of treatments which are available. And these should be decided according to the situation, based on the identified cause. It should also be based on other factors like age, or how long the couple has had infertility. Yes.
Okay.